Local health officials say they are seeing more RSV cases and other viruses as well. And with flu season on the way, they say masking can help prevent respiratory infections, especially with the Delta variant circulating. KMR Local 4's Kaylee Green has more.
Dr. Brian Weiss at Northwest Texas Hospital says it's already been a busy year for upper respiratory infections, including RSV.
It's been stunning to see RSV during the summertime. I mean, that's very unique. And then when we run these large respiratory panels, we're also seeing parainfluenza virus, rhinovirus, and enterovirus, and then some of the old-fashioned coronaviruses that we know have been coming through.
Dr. Lamentier says they're seeing it at BSA Hospital, too.
Continuing to see a lot of RSV as well, mostly pediatric patients, but some that are not pediatric.
He says high rates of RSV suggest we could be in for a worse flu season.
The potential for us to have a more severe flu season certainly is about to be upon us, especially with a reduction that we've had in masking requirements. That's why we're all recommending masking, because we're very concerned about multiple respiratory viruses taking place at a time when the risk is going to be significant for our citizens.
I'm a little worried about what we're going to see, as Dr. Lamentier said, going into the fall with flu hitting us and RSV coming back with a vengeance, and it could possibly be a busy fall into winter.
Co-infection is another concern. Amarillo Public Health Authority Dr. Todd Bell says last week he had 2 pediatric patients admitted with both RSV and COVID.
They ended up requiring the oxygen, having to come into the hospital. Yet another reason that if we can all get our masks on, it's going to be able to help not just with COVID, but with these other respiratory viruses as well, because all of those drain resources and obviously put kids in harm's way.
In Amarillo, Kaylee Green, KAMR Local 4 News.
The CDC is encouraging the public to get their flu shots this year. They say the demand of flu vaccine could be higher because of the pandemic.